MTP, induction of abortion. It is a deliberate termination of pregnancy either by medical or surgical method before the vitality of the fetus. So it is an abortion. It is not legalized in other countries, but in India we have an act called Medical Termination Pregnancy Act 1971. With that we have for abortion you need permission to abort any. So it is a legalized abortion in India. Deliberately induction of abortion is registered, but should be registered medical practitioner should permit under MTP Act. So it is என்னென்ன கண்டிஷனுக்குலாம் will be indicated. So only a medical practitioner MTP Act மூலமா it is legally you can do it. Illegally you cannot do it, abortion in India. So to practice this there are indications for termination under MTP Act to save the life of a mother. So mother's life risk la irundhuchna and that condition MTP can be done. So if the mother is suffering from cardiac diseases or any psychiatric illness or any carcinoma of breast, social indication almost the sole indication to prevent the grave injury to physical and mental health. So in cases when the pregnancy is caused by rape or unwanted pregnancy due to failure of contraception measures, in that condition social indication category la you can do MTP. Urogenic வந்துட்டு structural எதனா abnormality and fetus இருக்கு, அப்புறம் chromosomal abnormality down syndrome அந்த மாதிரிலாம் இருந்துச்சுன்னா we can go with MTP and do abortion. So extended indications what can all எதுக்கெல்லாம் indicate ஆகும்னா MTP பண்ணலாம், abortion பண்ணலாம்னா ரூல் படி in order to save the life of the pregnant woman or in order to prevent the grave injury to the physical and mental health of a pregnant woman. A still risk if the child is born with mental abnormality and severe handicap, in that condition also abortion can be done. Pregnancy occurs failure of contraception வந்துட்டு failure ஆகிறதுனால in married woman or husband is in purpose of limiting the childbirth, in that condition also we can do MTP. In few other special categories MTP can be done up to 24 weeks. So 24 weeks வரைக்கும் பண்றதுக்கான சில ரீசன்ஸ்னா survivor of sexual abuse rape survivor ஆறவங்க abortion can be done. If they are minors it can be done. It is during the ongoing pregnancy. During pregnancy appo if they change if they get divorced now in that time it is allowed. 24 weeks varikume abortion can be done. Women with physical disability, this can be done. And mental illness, women suffering from mental retardation, if the pregnant woman suffering from mental retardation, this can be applied. And fetus malformation and child is born with suffering, if it is born it will be suffering from physical and mental disability or handicap, in that condition also we can be done. Women with pregnancy in emergency situations declared by the government. In disaster management it can be done. There are new amendments in the MTP Act 2021. So recently they have updated. Recent generation confidentiality should be strictly maintained and the upper gestation limit is raised from 20 to 24 weeks. As told earlier 20 weeks munadi abortion can be done, but 24 weeks ku nama special categories paathom. But now ipo 20 to 24 weeks ke vandu MTP can be done. Okay va. So these conditions enna condition la conditions of failure of contraception applied to an unmarried woman who is not even married has got pregnant, even in that condition without contraception, if they have got pregnant, in that condition this abortion can be done. And pregnancy termination can be applied anytime during the pregnancy for in case of substantial fetal abnormality. So the fetal abnormality தெரிஞ்ச பிறகு any time in the gestation period any time it can be done. Restrictions 24 weeks குள்ள abortion பண்ணனும் அப்படி கிடையாது. You have any time fetal abnormality diagnose பண்ணிட்டாங்கன்னா they can abort it. To adding to that, even practitioners have got rules and regulations that should be followed. So in a registered practitioner should perform the MTP and one should have at least 25 MTPs authorized center having certificate. He has to be assisted in at least 25 MTPs. Plus he should have a 6 months house surgeon training in Obstetrics and Gynaecology department. He must have 6 months training, and then he has to get a diploma or degree in Obstetrics and Gynaecology. So termination can be performed in hospitals and also government places and approved by government. Pregnancy can be terminated on written consent of women. So written consent வந்து woman கிட்ட வாங்கிட்டு இந்த termination பண்ணலாம், or husband ஓட consent is not required. So pregnancy in minor girls la below 18 years la irundhuchna it cannot be terminated without the consent of the parents. So parent oda consent illama abortion cannot be done in a minor girl. Termination is permitted up to 24 weeks of pregnancy in opinion of one registered medical practitioner, and pregnancy beyond 20 weeks need opinion from 2 practitioners. So abortion has to be performed confidentially and only has to be reported to the Directorate of Health and Services. Now will be the complications of MTP. So complications are much less like immediate and remote. So immediate the injury to cervix and uterine perforation due to dilatation and evacuation surgery. The embolism, all these can be seen. Shock and hemorrhages. In remote, there will be gynecological and obstetrical complication. Gynecological menstrual disturbance will be seen. Chronic pelvic inflammation can be seen. There can be infertility due to block and scar endometriosis, and all these can be seen. Obstetric recurrent mid trimester abortion can be seen with cervical incompetence, and ectopic pregnancy can be prevalent, and preterm labor can be seen, increased perinatal loss, rupture of uterus, Rh negative women, failure of abortion and continued pregnancy. All these complications can be seen. Management, contraception advice should be given to the patients that should use IUDs or condoms or other barrier methods for unwanted pregnancies to prevent unplanned pregnancies.